California is cutting back healthcare access, and this time it's hitting undocumented immigrants. After expanding coverage just a year ago, the state now says the cost is too high. So what changed? Who's affected? And what does this mean going forward? Let's break it down. California's Medicaid program, known as Medi-Cal, is making major changes. Starting after the end of this year, undocumented adults will no longer be able to newly enroll in state-subsidized Medi-Cal coverage. And for those already enrolled, the state says coverage won't be free forever. Beginning in mid-2027, they'll be required to pay a $30 monthly premium to stay covered. This marks a clear shift in California's healthcare policy. The reason behind the rollback is simple: money. California is facing a widening budget deficit, running into the tens of billions of dollars. Healthcare costs have risen faster than higher hospital expenses and larger than projected enrollment. State officials say expanding Medi-Cal to undocumented adults turned out to be far more expensive than planned, forcing lawmakers to slow things down. Right now, non-profit workers are rushing across Los Angeles armed with iPads and clipboards. Their mission is urgent: sign up as many eligible people as possible before the cutoff. Once the deadline passes, new enrollment will no longer be allowed. The people most affected by this change are low-income, undocumented adults. For many families, even a $30 monthly premium can be the difference between keeping coverage or losing it entirely. Health advocates warn that some people may delay doctor visits, skip preventive care, or rely on emergency rooms instead, which could end up costing the system more in the long run. The decision has reignited a major political debate. Supporters of the rollback argue that California can't afford unlimited benefits during a budget deficit and that taxpayers are already under pressure. Opponents argue that healthcare access saves lives, reduces emergency costs, and that immigrants contribute billions of dollars in taxes and labor to the economy. Both sides agree on one thing: this represents a major shift in California policy, and this matters beyond California. The state often leads the nation on progressive policies. When California expands benefits, other states take note, and when it pulls back, they pay even closer attention. This move could influence healthcare debates, immigration policy discussions, and how states respond to budget crises nationwide. Isn't completely ending healthcare for undocumented immigrants, California, but it is clearly cutting back. No new sign-ups, monthly payments required, and thousands of people now facing uncertainty. What do you think? Should states provide healthcare regardless of immigration status, or is California making the right decision? Share your thoughts in the comments and follow for more clear breakdowns of major U.S. policy stories.